Hi everyone and welcome back to Dr. Carri's Clinical Corner. It's been a little bit since I've made any videos, but I've been thinking about this for a while. I just had some other projects I had to give my time to at the moment. But today we're going to talk about back pain and how that affects the pelvic floor. And I'm going to give you a couple scenarios of like what I've seen in the clinic. But let me just show you real quick. So I don't have a model of the full spine, but this is the spine. So this is your back, right? Your back muscles are up here. And then if we follow the spine all the way down, here's your tailbone. And then it becomes your pelvic floor. So your tailbone sort of is the very end of your spine, and it also connects into the pelvic floor. So there's a connection between back pain and pelvic floor issues. So obviously people come to see me in the clinic primarily for pelvic floor issues. But I always try to ask like, what else is going on in your body? And so many people have back pain. I'm sure all of you have had back pain at some point in life, right? It's so common. But let me explain how your back pain can affect your pelvic floor. So number one, we always think if your back muscles are tight, right? So we think back pain, your back muscles are tight. And these are just generalizations. Like back pain, since I've been in physical therapy school 20 years ago, we sort of don't have a great diagnosis for what causes back pain. It's a lot of factors. And sort of in the physical therapy and medical world, we call it like non-specific low back pain because we don't know exactly like what causes it. I'm going to talk in generalization. So in general, like we think if you have back pain, you probably have tightness in these back muscles, right? And if your back muscles are tight, your pelvic floor muscles are probably tight. And that's, I would say, generally like what I find with people. If your back is tight or your back is hurting, you're probably not moving as well from your spine, and that gets translated down to your pelvic floor. So I first saw this when I worked with cyclists. And so I created an online program of like exercises to do, but what I saw, there was a period of time randomly I had a bunch of cyclists come in with pelvic pain and pelvic issues, and what I noticed is a lot of them were very stiff in their spine and their hips, and that got translated to the pelvic floor. So imagine on a bike, you can't bend your spine, bend your hips. Ooh, this is going to take the impact. But now I see that in other areas too. So let's talk about back pain and pelvic pain. So if your back muscles are tight, your pelvic muscles are tight, right? And so if your pelvic muscles are tight, it's often going to cause pelvic pain. That one, to me, makes sense, right? So pelvic pain in women often comes as pain with penetration, pain with vaginal exams, pain with sex. In men, it often comes as I feel like I'm sitting on a golf ball. When I have patients who have pelvic pain and tightness, we work on these muscles directly, either on the surface, vaginally, rectally, whatever we need to. But then I often want to feel their back muscles, their hip muscles, look at their flexibility, because if this isn't moving well, it's going to translate to tightness here. So that's one way I really address that. So let me talk about some other scenarios that you probably wouldn't think about. So I've seen it also in patients with constipation. I can remember a few patients where I like examined them and I'm like, nothing really stands out. And they're like, oh, I've been having back pain. We work on the back pain, release the tightness of the back muscles. They poop better. Sometimes chronic constipation because they're straining a lot, they're putting a lot of pressure on that, their back gets tight, everything gets tight, the anxiety of it, right? I would say usually a side effect or secondary to chronic constipation is anxiety, and it's sort of this circle, right? I'm anxious about not pooping, my pelvic floor muscles are tight, the anxiety causes more tightness, right? It's this vicious cycle. It's hard to get rid of, and it's often a lot of deeper things we got to work on, including mental health therapy for a lot of those clients. Goes hand in hand with physical therapy. So that one still kind of makes sense. I've seen prolapse symptoms exacerbated. So prolapse means like it feels like, oh, my my organs are falling out, or it feels heavy in my pelvis. I've seen that exacerbated by back pain. So again, we used to think prolapse, you gotta like strengthen the pelvic floor, right? Support the organs, but really our organs are suspended by ligaments above. And now kind of the current theory is like, we need to create more space for these organs to exist if they're in a lower position. We've got to get rid of the tightness. The tightness will take some of the pressure off. So makes sense, if your back muscles are tight, then your pelvic floor muscles are tight, creating more prolapse symptoms. Constipation also is sometimes a factor in prolapse symptoms. So if back pain makes constipation worse, back pain makes your prolapse symptoms worse. Not everyone who has prolapse has constipation, but I see those together a lot. And the last one seems very, very like counterintuitive to people, but I've had multiple people, even recently in my clinic, who have bladder leakage and back pain. And the back pain was actually a big factor in their bladder leakage. So you can have pelvic floor muscle tightness and have bladder leakage. I see it. No one believes me, even the patients themselves, until I show it to them when we do a pelvic exam. But not every bladder leakage is pelvic floor weakness and needing to do more Kegels. Sometimes it's pelvic floor muscle tightness. So I can think of a few scenarios off the top of my head. So oftentimes women who have bladder leakage with coughing, sneezing, laughing, we call that stress incontinence, running, jumping, exercise, they often have pelvic floor muscle tightness. And so the pelvic floor is supposed to be like a trampoline. It's not like, oh, we turn this on, right? Like, we're gonna hold this while we run, while we jump, while we lift weights, while we cough, while we sneeze. Maybe sometimes with coughing and sneezing, but that's not how it's supposed to work. It's supposed to react. Like, it's supposed to just sort of live in a kind of like relaxed state. And then when we need it, it turns on and then it goes back to that state. But a lot of my patients, they're sort of stuck in this tight state and then it can't react. So especially if it's like with exercise, with coughing, sneezing, it's already tight, and so it can't tighten anymore when it needs to prevent leakage from that force of running, jumping, or sneezing. So you can have pelvic floor muscle tightness and bladder leakage. So I've seen that in a few patients lately who, when they come in, they're like, oh, also I have this back pain. And honestly, for some of them, I really get better results of their pelvic floor if we work on the back pain first. So sometimes we work on them both together. Sometimes it's like we got to work on the pelvic floor symptoms before the back pain. Sometimes we got to resolve your back pain before any of your pelvic floor stuff is going to get better. So it kind of depends clinically, but if you have back pain and you're going to pelvic floor therapy, tell your pelvic floor therapist and hopefully they will address it because, you know, in my perspective, it's like I got to look at the whole person, especially when it comes to people who have bladder leakage or pelvic pain with activity. So it's not just on the toilet or related to pelvic specific things. It's like I have bladder leakage when I run. Okay, we got to look at how you run. We got to look at your leg strength and your flexibility and how you hit the ground with your foot. All those things matter. So that's why addressing your back pain might be the missing piece to addressing your pelvic floor issue. So again, even bladder leakage, constipation, prolapse symptoms, and pelvic pain are all scenarios I've seen that were when we worked on people's back pain, their pelvic floor symptoms got better. Okay, so just something to think about. Inform your pelvic floor therapist if you're going to it, or address your back pain and see if that helps your pelvic floor symptoms. Okay, see you next time.